Good afternoon, everyone. Welcome to today's session with the School of Continuing Studies at the University of Guelph. I'm glad you can join us. We have about 35 registered participants, so hopefully within the next few minutes we will see more of you joining us. My name is Fazil Rashid, and I'm a manager of program development here at the University of Guelph in the School of Continuing Studies. And I manage the human health and development portfolio, and One Health is part of that portfolio. So that's a little bit about myself. University of Guelph. Before I get started, just some background on the University of Guelph. Our main campus is located just out of Toronto in Guelph, Ontario, and we are known for our leadership in food and agriculture, animal, human, and environmental health, which all falls into that One Health philosophy, as well as engineering and business. We're home to over 30,000 students from more than 140 countries, and everything we do here is grounded in a simple commitment to improve lives. Before I introduce Dr. McMullen, I just wanted to highlight that this session is recorded and will be sent out after the presentations. And that during the presentations, if you have any questions, you can certainly put them in the chat. And after this session, we will try to answer as many of those as possible. So it's now my privilege to introduce Dr. McMullen, our speaker today. Dr. Carrie McMullen is a postdoctoral scholar in population medicine and One Health at the University of Guelph, where she specializes in evaluating One Health interventions in both community and higher education settings. Currently, she is assessing an educational program in Rwanda that aims to improve the lives of women and girls through lessons in zoonotic, waterborne, and foodborne diseases and gender transformative principles. She holds a BSc in animal biology and a master's in population medicine and a PhD in population medicine and One Health. Using both qualitative and quantitative research methods, Dr. McMullen is passionate about working directly with individuals and communities and about learning from people with lived and living experiences through collaborative discussions. She deeply understands the value of challenging assumptions and integrating diverse perspectives as a path towards better addressing complex health challenges. Today, she'll be talking to us about a topic named a farmer's nightmare, a One Health opportunity, breaking silos and building connections. And without further ado, I'd like to welcome Dr. McMullen to the session.
Thank
Dr.
you.
McMullen.
Thank you, Fazil. And thanks to the School of Continuing Studies for inviting me to talk about something I'm very passionate about, which is One Health, of course. Just an overview of what we're going to be discussing today. I have an introduction about me and my roots and connection to the land, which really informs the respect that I have for Indigenous peoples. We're going to talk about what is One Health in case you're not familiar thus far, why we might want to apply a One Health approach and why it's relevant to you working in different industries and areas. We'll talk about some One Health competencies and tools, which is a topic I spent some time on during my PhD. We'll get to the building connections part of this talk as the title suggested. And then we have a One Health micro-credential at the University of Guelph that I am excited to introduce to you at the end of the talk. And then, of course, we'll have a question and answer session in case there's anything I can help you with, or if you have questions, I'm happy to discuss those at the end. So, a little bit about me. As Fazil said, I'm currently a postdoctoral scholar in the Department of Population Medicine, and I have completed all of my education at the University of Guelph. So, I truly am a Griffin through and through, and I really do love this institution. I'm also an epidemiologist by training, and I've worked in various organizations. One of my favorite roles that I've held was doing some clinical epidemiology research in an emergency department at a hospital in Ottawa. And it was really quite exciting to take what I learned through my education and be working directly with patients to enroll them for clinical trials and some other things we had going on in the emergency department. I've also held an epidemiology position at the Public Health Agency of Canada. So it's kind of nice that I've experienced both ends of the spectrum, from direct patient care to quite further removed from the public. But like any postdoctoral scholar, my heart really is in research. So to provide a little bit more context on what I'm currently doing in Rwanda, my principal investigators that I'm working with have developed this education program where we've invited health workers from several different villages in Rwanda to come to this training modules that we would host about once a month. And they came to 12 different trainings. And we talked about what One Health is, what zoonotic and foodborne diseases are, and how to protect and prevent those diseases in human and animal populations. We also talked about what it means to collaborate as a team, because as a lot of us know, sometimes human health workers kind of work on their own separate from the animal health workers. And we really wanted to introduce the concepts of collaboration with these health workers in Rwanda. And we talked a lot about pig management. There was a big focus on diseases that we can get from pigs, as that's an important livestock species for these communities. So we're currently in the stages of evaluating the impact that that program has had, both on knowledge gain for the health workers that came to the training, but we also want to understand what happened when those health workers went back to their communities and shared the knowledge with different community members, village members in their area, and see if there's been a change on the health status in these communities. So as you can see on the slide, I have some fun pictures there. And this is another piece of my identity that I'm very proud of. But I'm a fifth generation member of a cash crop family from southwestern Ontario. And this has really informed my approach when I use One Health in my work. Maybe some of you can relate to this, but I've seen too many examples where we have different initiatives or policy implications come out, especially in the agriculture world, where people developing those initiatives or policies have not involved those that are impacted by the outcomes or outputs at all throughout the process of developing and implementing those things. So I really understand how harmful it can be and how those initiatives end up not being sustainable, because we never got buy-in from the people that matter most when it comes to those initiatives or policies. And that's one thing that I love about One Health, is really the emphasis that we place on involving community and involving these voices that are traditionally marginalized or left out of our initiatives throughout our research process, and not just involving their voices kind of at the tail end of our research. So I'm making a little bit of a joke here that we have these new triplet goats on our farm now, and they're fully integrated into the family as pets at this point. And sometimes they can be nightmares in their behavior and jumping around on things, but they're not the nightmare that I'm here to discuss today. I also think, as a member of a farm family and someone who spends a great deal of time in the One Health space, I'm constantly reminded of my connection to animals and to the earth. And it's a great reminder to me every day of the great respect that I hold for the Indigenous peoples who walked this land before me. And it's with great respect that we acknowledge that the University of Guelph resides on the ancestral lands of the Attawandaron people and the treaty lands and territories of the Mississaugas of the Credit. I also think, as a One Health practitioner myself, and as we gather in a One Health space, we all have a shared responsibility to care for the land and all life that inhabit Earth in the spirit of peace, friendship, and respect. So what is One Health? Well, in 2021, we had the World Health Organization, the Food and Ag Organization of the United Nations, the World Organization for Animal Health, and the United Nations Environment Program come together to form what's called the Quadripartite One Health Joint Plan of Action. And out of that plan of action, they also formed what's called the One Health High Level Expert Panel. And one of the things that kind of sparked this quadripartite alliance is that they all decided that by working together and leveraging their respective expertise and resources, that we can hopefully contribute to better attaining optimal health for people, animals, and ecosystems compared to if those separate organizations worked independently. So one highlight from the high-level expert panel was that they found that One Health was not uniformly being defined or used throughout the world. And I think this is still a challenge that we're navigating today. But this panel came out with this pretty intricate definition for One Health that we try and reference as often as we can. So they talk about One Health as being an integrated, unifying approach where we're trying to balance and optimize the health of people, animals, and ecosystems. And One Health really recognizes that the health of these different entities, including wild animals, our plants, our wider environments, are really closely linked and interdependent. So our approach in One Health is something we use to mobilize different sectors, different disciplines, where we include community in our work at varying levels of society, where we really want to work together to foster well-being and tackle threats to health and ecosystems. There's also several fundamental principles that we lean on when we apply the One Health approach. And these are also outlined in this definition by the high-level expert panel. The first is about equity and inclusion of all people. So this is trying to get equitable representation across sectors and disciplines, of course, but then again, bringing community into the conversation and including the engagement of traditionally marginalized voices. Balance and equilibrium between humans, animals, and environments is something we strive for. So trying to recognize that all three of these different pillars have intrinsic value in and of themselves and not just value because of what they're able to provide to humans. Stewardship and having humans take responsibility for their actions and adopting sustainable practices, working as a true partner with the land and animals, as makes my agricultural roots very happy, is also another principle. And then transdisciplinary collaboration. So where we're trying to include all relevant disciplines, all relevant actors at the table, regardless of whether they're deemed an expert in an area or traditionally deemed an expert, because we have so much to learn from anybody that can come to our table related to a problem. We also want to value Western science and non-Western viewpoints equally. So this expert panel also created a new image that we associate with One Health that's a bit more intricate compared to the traditional Venn diagram model that we're used to seeing associated with One Health. So this new diagram emphasizes what we call the 4 C's in the quest for implementing a One Health approach for effective change. And these 4 C's are communication, collaboration, coordination, and capacity building. And we really lean on these C's as foundational pillars for implementing our One Health initiatives worldwide, and they can help us ensure fairness, equity, sustainability in our approach. Now, when we think about the 3 pillars related to One Health, humans, animals, and environments, At the University of Guelph, we've tried to move towards using the term ecosystem instead of environment because we want our definition for the environment to be quite comprehensive. So, of course, we place emphasis on the natural environment, but we do know that in a complex world, we recognize the importance of recognizing our built environments as well and those that are socially constructed when we think about our determinants of health, especially such as political, financial, and social environments. So, really trying to get at a comprehensive definition for what the environment might mean. This is one of my favorite figures right now to describe the traditional two types of One Health that have kind of dominated schools of thought in applying the approach. So the first is the left-hand figure in this picture, and it's called the anthropocentric hazards model. So this model has roots in veterinary public health, and it focuses on detecting, managing, and eliminating hazards to people that might arise in animals or the environment. So this model and way of thinking in One Health is still really placing humans at the top of the pyramid and as the primary beneficiaries of this approach. The second type of One Health is the socio-ecological One Health model, which has its roots in the Ottawa Charter for Health Promotion that was developed in 1986. And this model advocates for the equilibrium principle that I just talked about. So the balance of health between people, animals, and the environment. And I think this is really key in trying to get at the point that each of these pillars have intrinsic value and intrinsic health of their own that deserves protecting, not just for the benefit of humans. And this is the type of One Health that I try and use in my work, but you certainly still see both models out there. So it's also extremely important that we understand and acknowledge that One Health and our other holistic health approaches that you might hear out there, like eco health or planetary health, are really borrowing from ideas that Indigenous peoples have held since time immemorial. They've always understood and viewed the world as an interconnected system. So this figure that you can see on this slide is credited to Dr. Amy Kahi, who is a recent graduate of my department and now works for the government of Nunavut, as far as I know. And they developed this depiction that I think beautifully captures our shared responsibility to care for the land and really helps to elaborate on the interconnections that we seek in One Health. So this figure is published in the Alaskan Inuit Circumpolar Council report from 2015. And they state alongside this image that Alaskan Inuit food security is the natural right of all Inuit to be part of the ecosystem, to access food, and to caretake, protect, and respect all of life, land, water, and air. An elder goes on in this report to describe that the Arctic environment is like a puzzle, with all pieces having a place and all pieces necessary to make up the entire picture. I think you can imagine that if we're only to examine health related to one of these pieces of the puzzle, then we're missing all of the wonderful and complex interconnections that that piece has with the entire puzzle. So I really like this image and what it means for One Health. Okay, so the real farmer's nightmare here is a broken silo, of course. And we know that silos persist in every large organization and that people continue to work with others who are in the same discipline and likely think in a similar way. And there's some good reasons for why silos might exist and why they continue to persist in our organizations. The first being, of course, silos allow us to have this really deep understanding and deep expertise and be a specialist in a small or niche area. And we need that expertise and depth in working in our One Health problems. It can also feel valuable to be the only one who understands how something works, especially if you're in kind of a niche area. And sometimes sharing knowledge with others can feel like we're giving away power. There's also certainly limits to data and information sharing. And as someone who has worked in the government space, I certainly understand these challenges that we're facing. And IT security is a great concern and something that needs to be protected. And although silos can feel safe and efficient, I think they're really expensive for what we're trying to do to tackle these complex health challenges. They can sometimes create delays, confusion, duplication of efforts across different organizations or different departments within an organization even. They can create mixed messages that we're, trying to say essentially the same thing to the public, but coming at it from different angles. And innovation really suffers when we don't bring different minds together. I think the biggest challenge that silos offer us is that they can erode empathy when we work with others. So we can really stop trying to understand what others care about and stop seeing shared goals that, if we work together towards the path that aligns with our shared goals, maybe we can attain those goals a little bit easier if we work together. So why might we apply a One Health approach, and why is One Health valuable to your career? I think the first most obvious option for us in applying a One Health approach is that it offers us a more holistic understanding of the problems that we're trying to address. So when I come at a problem from my lens as an epidemiologist, and I'm, not wearing my One Health hat today, I will in no doubt have these blind spots to components of the problem, or even who that problem is going to impact. So when we bring other people to the table who have expertise in different areas, we can help to fill some of each other's blind spots and identify a more fulsome understanding of the problem we're trying to tackle. I think another reason for applying the One Health approach, and I'm sure many of you are challenged right now in the current state of the world, with finding enough time, money, and personnel to complete even your required tasks for your career, let alone trying to implement a new approach. And when we use a One Health approach, we have more people who are able to work together from different sectors, disciplines, community, and we can pool some of our resources, energy, and knowledge to try and make some of these things a bit easier than always doing it off the side of our desk. I also like that One Health offers us a more sustainable approach, getting more buy-in upfront to some of these things we're trying to do when we invite many people to the table. So again, from my agriculture background, if farmers are involved from start to finish in a project where we kind of create these shared goals, shared outcomes, we're hopefully creating something that's going to be more long-lasting. We're also able to identify consequences of our interventions, solutions, or problems that, again, me working as an epidemiologist might not even envision that that's a potential consequence of what I'm trying to do. But when we have different disciplines coming to the table, they can help us to foresee, if we do X, Y, Z, that's going to lead to these unintended consequences that could be really harmful. We're also currently faced with an ever-growing challenge of misinformation and distrust in science. And I think if we have collaboration from different disciplines throughout different parts of a project, we can help to reduce the mixed messages that were relayed to the public or our target audience. And I truly think that working with others who have a different perspective or worldview is so very rewarding. And I've learned so much from being able to work with people who are outside of the traditional bounds of where epidemiologists might work. Another reason for applying the One Health approach is that One Health problems are also inherently complex. And a lot of our health challenges that we're faced with today are ever increasingly complex. So complex problems are characterized by these interrelated components and interactions. There's a lot of uncertainty in these problems, and there isn't going to be only one correct answer to our problem. So in One Health, our challenges are often complex because it's such a dynamic, ever-changing issue, and we have dependent relationships between human health, animal health, and ecosystem health. So in One Health problems, we have these many interactions potentially between a pathogen or virus. We have animal hosts involved in the problem. We have human populations to consider. We have environments, either natural or built, socioeconomic drivers. And all of these things interact to dictate the course of a disease and its magnitude of impact. So it's not going to be possible to tackle one of those factors without influencing others because of all those neat, unique interconnections that are happening. And I think a really relevant example of this is avian influenza in Canada. We've all probably heard about what was happening earlier this year, the prior year. So that's a really complex problem that can benefit from the One Health approach. And these are not to be confused with complicated problems, of course. I'm sure a lot of you are dealing with complicated problems on a day-to-day basis, but complicated problems have interrelated parts, but there's often a predictable pattern that that problem is going to follow. We can break down complicated problems into simpler components for analysis or intervention. And if we bring the correct theory to the table of a complicated problem, we can find an answer to that problem. So that's very different from the complex problems we talk about in One Health. Okay, so to talk about One Health competencies, we're talking about the knowledge, skills, attitudes, values that we need to use when we apply the One Health approach. And as you can see from this overarching list that's on the slides, a lot of these competencies in One Health would be beneficial for any job or discipline where the goal is to have healthier animals, people, plants, and ecosystems, where the goal in our career might be to focus on interconnections and really working together to solve problems, and where we want to do better and make positive change, essentially. So One Health involves the need for us to have some depth of expertise, but it also involves these more generally applicable knowledge and skills that are relevant to many of us, no matter our industry. So on the specific expertise front, we talk about understanding different definitions and perspectives of health. So again, not always viewing the problem from a Western science perspective, for example. Having a depth and breadth of understanding of a problem. So this is where I think it's really neat that, you know, my depth of expertise is in epidemiology, and I could come to a One Health space with that depth of expertise. But you also need to have this breadth of understanding of the problem that you can, you know, lean on your peers that have come to the table too to kind of build that breadth of understanding. We need to understand what resilience and adaptability look like in different species, perhaps, and also for systems. We apply systems thinking in our One Health space. We apply transdisciplinarity in our One Health space. And we talk about being very reflexive in our approach or practicing reflexivity. And this just means taking a deep dive and understanding how our identities and bias might influence the project that we're working on. And then on the more generally applicable expertise front, leadership and collaboration is huge. Knowing when to lead a team versus when to let others lead in a team, being able to practice strategic planning, being able to engage communities and let communities participate in the way that they would like to participate in. Problem solving and critical skills is huge. So understanding qualitative and quantitative methods is part of that. Being able to collect and use different types of data from across human, animal, and environmental pillars is really important. Knowledge mobilization and communication, I think that goes without saying for a lot of us. And then on the professional and ethical behavior side, because we try to be so equitable and inclusive, I think it's important to understand what that might look like in a collaboration or working on a One Health project. And then advocacy, which can look like a lot of different things, but we might use it to raise the voices of, again, people who have been traditionally marginalized in our project and giving them the platform if they would like that to have their voice heard. So there's a couple tools that I want to introduce that we use in the One Health approach and help us to kind of come to the table and be able to address this complexity that we talk about in our problems. The first tool is systems thinking. And I would like to someday take a whole year-long course on systems thinking because I think it's so fascinating. But it's defined as a holistic approach to examining a system where we're going to understand the individual parts of that system and how it's interconnected, but we also want to understand how that system fits into our broader context that we're dealing with. So in systems thinking, we consider a few different components. The first is the scale of our problem, of course. So, are we trying to tackle a problem that's just specific to the University of Guelph campus? Is our problem broader at the city of Guelph level? Or maybe it's a national problem we're trying to address. We talk about nonlinearity in our systems thinking. So again, we don't just flow from point A to point B, and that's an easy place where we can intervene in this system. We really do have this complex kind of loop-de-loop going on in our systems. Feedback loops is also something we talk about a lot. And then, of course, having uncertainty in our system, trying to identify unintended consequences up front, even if we thought we brought all relevant actors to the table to address a problem, there's still going to be things that are uncertain in our systems. So it's good to be able to try and talk those questions and uncertain points through. The second tool is called transdisciplinarity. And if you look at the figure that's on the slide for transdisciplinarity, you can see that the more siloed our disciplines are, so working at the disciplinary or multidisciplinary level, the simpler the problems that we're going to be able to address, or even the solutions that we come up with to those problems, the more simpler they will be. So transdisciplinarity is an approach that brings together and integrates different perspectives and knowledges to generate new ideas, understandings, and approaches. And that's a bit different from interdisciplinarity or multidisciplinarity. So not to be confused with those concepts. Transdisciplinary collaborations allow us to break those silos. The research areas, the questions, the methods that we bring to our research questions are now co-created by all collaborators, which can include people working in your discipline, people working in other sectors, but also what we call our extra scientific actors, or those people who are in society or in community. And we really try and focus on real world problems when we form our transdisciplinary collaborations. Another part about transdisciplinarity that I really love is this focus on enabling mutual learning to happen between those people traditionally deemed as experts related to a topic and our society or our community members. Um, I think it's so valuable when you can come to a table, no matter what your educational background is, and come with an open mind to understand that you can learn from everybody else at that table, no matter how long you've been in a role. And a great example we have in that's relevant to Canada is our Canadian Lyme Disease Research Network, which one of my advisors in my PhD, Dr. Katie Clow, is heavily involved in, where this research network has brought the usual suspects to the table, where we have basic scientists, epidemiologists, veterinarians, physicians. We've involved social scientists in this problem, where all of those quote unquote experts are working together. But now this research network also involves patients or those who have been impacted by Lyme disease as equal collaborators. So they're invited to the tables, and all of those experts are able to learn something from those most impacted by Lyme disease. Okay, so now on to the building connections side of One Health that is so important to me. And I want to share a couple sentiments with you about building connections that are things that I try and keep in mind when I apply the One Health approach. So the first comes from a quote in a paper by Dr. Lauren Van Patter, who is a professor at the University of Guelph, and some colleagues published this paper as well, that highlights that when working with others, mutually beneficial relationships should not equate to reciprocally beneficial relationships. And I'm just going to read this quote so that hopefully we can all sit with it for a minute. In Western colonial capitalist approaches to relations with animals, and this can certainly extend to other beings or the environment, there's often an expectation of give and take, that generosity requires some manner of reciprocation. But the notion of commensal relations thwarts this, wherein sharing a table is not premised on what each party can bring to that table. They continue that we should ask ourselves, what might our collaborations look like if flourishing is thought of as mutual, but not necessarily reciprocal, grounded in the act of sharing without being owed and taking without being indebted. And I really, really resonate with this quote, with my agriculture background and what we try and do in One Health. I think that's that beautifully captures that. The second sentiment I want to share with you is something called the trust equation. And I was introduced to this equation through a One Health seminar a few years ago now, where we talk about trust as the function of credibility in the numerator. So, are we knowledgeable about the subject that we're trying to talk about? Plus reliability. So, do we do what we said we would do and to the same quality? Plus our intimacy. So, did we make the person we're trying to work with feel safe by sharing our own vulnerabilities, insecurities, and doubts, as opposed to, coming to the table acting like we have no flaws and we're almighty and powerful? But this is all divided by what's called self-orientation or self-interest. And our trust with people can totally fall apart if we come to the table with a high degree of self-interest, if we're bringing a lot of our ego to the table, or if we have ulterior motives for the collaboration that we're not being upfront about. And again, as someone who has one foot in agriculture and one foot in academia, I think these ideas around trust and mutually beneficial relationships are some of the biggest challenges we have for building connections, for any collaboration that we might be interested in, but especially for our One Health collaborations. And a final sentiment about building connections in One Health that I want to share is this quote that we all know about the whole being greater than the sum of its parts. And again, if we continue to work in our silos, we have very wonderful, fabulous work being done that's specific to an animal health discipline or expertise. We have wonderful work that's happening in the human health space and environmental health alike. But if we continue to work in those silos, we're really missing the added benefit of what can happen when we pool our data, information, knowledge, and resources together. And this isn't a space where I wanted to talk too much about my own research that's going on, but just to share a little vignette, I guess, from what we're doing in Rwanda. One of the goals of the project has been to prevent infection from Taenia solium, which is a parasite that causes tapeworms in people called taniasis when they eat infected pork. So that's why this project has such a pig management focus. And it can also cause epilepsy as part of neurocysticercosis when humans ingest those tapeworm eggs. So in these villages that we're working with, we've implemented a few different interventions. The one that I'm most intimately involved in is, of course, this training of community One Health teams and those health workers coming to our training modules, where we're building knowledge about One Health and ways to prevent zoonotic diseases. There's been another team working on building latrines in homes and marketplaces where we're trying to help stop pigs from accessing human feces, which is an important part of that life cycle. We've been treating people if they're infected with the tapeworm, and we've been vaccinating and treating pigs. So a few different interventions going on. But one of our partners on the project from the Institute of Health Economics in Edmonton, Alberta, they're conducting a cost analysis to understand the cost effectiveness of each of these interventions on their own in terms of healthcare costs related to humans or animals, in terms of productivity losses associated with disease, in terms of are we lessening T. solium cases in humans or pigs in these villages? And there's some work going on about disability adjusted life years. So they're modeling the cost effectiveness of those interventions on their own, but then they're going to bring all of that together in a combined model to understand what the combined effectiveness is of the total One Health intervention or all those interventions combined in these villages. And the results of this work are not yet available, but if we think about the whole is greater than the sum of the parts, I bet there's going to be a greater benefit than if we were to sum up the individual interventions as though they were done in isolation. So I'm really looking forward to seeing where that work goes. And just briefly on the Mobilizing One Health micro-credential we have at the University of Guelph through our School of Continuing Studies. If you're interested in learning more about One Health and how you might be able to use it in practice, this is a 7-week course that's fully online. And our next offering of the course begins in October and ends in December. So if I haven't convinced you yet that you might want to learn more about One Health, either through this credential or through different avenues, I think some reasons why I would say that we should study One Health or that you might want to study One Health. Um, the first is that whether or not you think in an interconnected way, or whether or not you work with other disciplines or communities in your normal business, in your career, I think there's some intricacies that One Health education can certainly help us with. So understanding some of the concepts and the theory behind One Health is really important, and that's something One Health education can offer. Also, systems thinking. As I said, I want to take a whole course on this myself. There's a lot of components in systems thinking, and there is kind of correct and incorrect terminology that we use. And it also involves what's called systems mapping, which is an important skill to learn. I also think it's great to start working with people that, or different disciplines, or people with different worldviews that you may have never worked with before in a low impact environment. And this is something I love about education. It just offers us a space to fail spectacularly, as an old mentor of mine would say, where you might have a grade associated with a project or something, but it is a low impact environment to fail and learn from those mistakes rather than trying to implement something new in our workplace. And the final sentiment is that a lot of our organizations are aligning with One Health now, either One Health being in the strategic plan for an organization, or a lot of funding opportunities now. Say, if you follow the One Health approach, that's a great way to access that funding. For instance, the Canadian Institute of Health Information, I know the Public Health Agency of Canada is moving in a One Health direction as well. So it can help you build those skills that you might need to support your organization, kind of meet those strategic priorities. And that is all from me. My email's there if you'd like to reach out about anything. And we have our question and answer session.
Yeah, thank you, Dr. McMullen. That's such a rich look at One Health, what it truly means, and highlighting the importance of trust in breaking silos, not just data. So again, as Dr. McMullen mentioned, we now open it up for questions. Feel free to drop your questions in the chat, and we'll try to answer as many of those as we can during the remaining 11 minutes or so. So I have a question that came in. For those thinking about where this kind of training could take them professionally, what are some of the career paths open to people with a background in One Health?
Sorry, I'm just seeing the participants for the first time here now that I've stopped sharing
Uh,
my screen. Hello to
oh.
everyone that I've met before that I know, and hello to those that I don't know. Yes, so um, to give you the answer that always makes people roll their eyes, I think One Health can be applied in any career, Fazil. But to give a more specific response, I think the obvious entry point for One Health is in our public health spaces. And this might be in public health officer roles with epidemiologists. Those people work, those working in disease surveillance, health promotion, health policy. I think another space I've spent some time in is in the climate change space. And as a truly complex problem that is impacting a lot of different sectors right now, I think anywhere that we can say that putting health first is beneficial is a great place for One Health to be. So in the climate change space, we might be working with urban planners or architects, engineers, those working in emergency preparedness and response that aren't traditionally used to putting health first. I think we can start to have those conversations, and is a great place for the One Health approach to be applied. Obviously, we have our animal health experts. Veterinarians have been huge proponents of the One Health approach. Those working in wildlife health and conservation is another great place for One Health to be. And at the University of Guelph, we have some really great things happening with how we're applying One Health throughout the university and who's kind of being involved in that conversation. So we have people from the engineering college, we have people from computer sciences at our One Health tables. Yeah, so I think you can kind of do anything with this approach, and it's valuable to a lot of different spaces.
Now, at the University of Guelph, we're known for our One Health philosophy and approach. With respect to the micro-credential itself, now since you're so close to it, what would be some of the elements that really stand out, the strongest elements of that micro-credential?
Yeah, that's a fun question. I think the way this micro-credential has been developed to facilitate you working with other people. And, when you register, we ask you what your background is or what kind of career area you come from. So when we form our groups in that micro-credential, we really try and get you working with other people that don't have the same background that you come to the table with. And again, offering that space that's kind of more low impact to help you facilitate those conversations before you do that in a career setting is really cool about the micro-credential. I also, again, my passion for systems thinking, we introduced the idea of concept mapping in the micro-credential. So it's a bit of a nicer introduction to systems thinking. And the next step would be to then systems map. So to be able to be introduced to the concept mapping and how that looks in a One Health space before you move into real systems thinking and real systems mapping is really valuable.
Thank you. That sounds very much like the interdisciplinarity you mentioned as well, which speaks to that collaboration and cross-pollination of disciplines. There's a question from Zeminu here about the effect of antimicrobial resistance on One Health.
Oh,
What is the effect? Yeah.
So it's interesting when you look at the history of One Health and kind of its roots in One Medicine is what it's called. One Health has been traditionally been applied in the space of antimicrobial resistance and in the space of zoonotic diseases. So this isn't an area that I've spent much time, but we have what's called the Canadian Integrated Program on Antimicrobial Resistance Surveillance, I believe. It's called CPARS in Canada at the Public Health Agency of Canada. And they have done an incredible kind of live action application of the One Health approach and what that can look like in terms of AMR across different animal species, in human populations, and how you might look for AMR in the environment. So it's the One Health approach is certainly a place and space that should be using the One Health approach, absolutely. And I encourage you to look at CPARS if you have not already heard of that program.
There's a question, I guess this relates to your work in Rwanda. And the question is there a plan to extend training in other sectors because the sample is not enough compared to the total population of a district? And that's
Yeah.
referring to the Nyamagabe district of Rwanda.
Yamagabe district. Yes, I see one of my collaborators, Joshua, on the call. I think what we're trying to do with this initial smaller scale sample, as this person might be alluding to, is to kind of show proof of concept and that what we're doing has actually impacted the health in these villages that we're working with. It's a project that's funded through Global Affairs Canada, so we have a lot of reporting that goes up to them and really showing the added value of this One Health approach in the communities is something we're spending a lot of focus on in the last year of this kind of project that's running. So I certainly hope that, what we've done shows the added value to people who fund this kind of work and that we can expand it to other villages, either in Yamagabe district, Rwanda, other parts of Rwanda, or other countries as well. So we really hope that that's a future direction.
Thank you. So we just have about 3 minutes remaining. So if there's any other question, please get them in the chat. I do have one quick question, Dr. McMullen. What would be one of the challenges, or what are challenges that organizations are facing in adopting a One Health approach versus just talking about it?
Yeah, that's such a good question, and something we try and spend a lot of time on in the One Health circles I'm involved in at the university. So breaking down our silos and building that trust with our collaborators, as I spoke to in the presentation, is a huge challenge that we're navigating. We also have this interesting time of different holistic health approaches being supported or promoted by different organizations or sectors. So, for example, I said veterinarians have been a huge proponent of the One Health approach, and we've certainly brought other people into that kind of umbrella. But a couple years ago, the medical schools in Canada endorsed what's called planetary health. So, really, with all these holistic health approaches, we're getting at the same point. We're trying to improve health that's beyond, just human health. But it does present a challenge when I'm over here advocating for One Health and somebody else might be advocating for planetary health, and, the confusion that that can cause. Yeah, so I would say those are a couple challenges.
Thank you very much. So that's all the time we have. It's about 12:58 right now. So again, Dr. McMullen, thank you very much for such an insightful presentation and highlighting exactly what One Health is to some of us who weren't quite aware. And thank you all for joining us today. If you're interested in our micro-credential, their information is being shared in the chat right now, and you can certainly find additional details on our website, the School of Continuing Studies at the University of Guelph. And I think it sounds like some of you are in contact with Dr. McMullen, so I encourage you to have those conversations as well if you have any additional questions. Thanks again, and have a good day.
Thank you, everyone.